Dr. Someshwar?
Hi, Venkateshan. So, shall we
Yeah.
start?
Yeah, just Dr. Divya, this is our medical affairs team, Dr. Someshwar.
Hi, ma'am. This is Dr. Someshwar.
Good evening, Mr. Someshwar.
Good evening, ma'am. Ma'am, with your permission, shall we start?
Yeah, definitely.
Okay, ma'am. Yeah. Good evening, doctors. This is Dr. Someshwar from Shield Healthcare. I welcome you all on behalf of Shield. Thank you very much for joining today's webinar. I request all the participants to post their queries in the comment box so that we will have a expert comments on at the end of the webinar. And good evening, Dr. DivyaTejujaSahetya. Thank you for joining today's webinar, ma'am. It's always an honor to introduce ma'am.
Thank you.
Uh, Dr. Divya A. Sahetya, she completed her medicine from Lokmanya Tilak Municipal Medical College from Mumbai, and she did her MS from Bombay Hospital Institute of Medical Sciences and ICOG Fellowship in Reproductive Medicine. And coming to residency, she have worked in HBT Medical College and also R.N. Cooper Hospital, Patnakar Hospital, and Genesis Fertility Solutions. And also, she worked with Dr. Shirish Sheth, who is a world-renowned vaginal surgeon, as well as Dr. Jatin Shah, and also she is a currently infertility and IVF consultant and gynecologist at Pushpa Hospital and Brilliance Fertility Center since 2019. And coming to the papers presented, she presented a paper on KP study on HPV vaccine at AMWI conference, as well as KP study on HPV vaccine on 225th clinical research meeting. Coming to the chapters written, she have written a chapter on non-infective causes of pyrexia and pregnancy for the textbook of obstetrics and gynecology launched at IECOG 2016, co-authored by Dr. Reena J. Warren. And also chapter on general view of genetic counseling in ISPAT, Indian Society of Prenatal Diagnosis, textbook of principles and practice of fetal medicine. And also she written a chapter on diagnosis of fibroids, co-authored by Dr. Ankesh Sahitya in the book How We Manage Fibroids by Dr. Narendra Malhotra. Ma'am, with this, we welcome you, ma'am, for today's webinar. And before proceeding to the webinar, we have a short AV on Shield Connect, which is a digital platform. I request Chitrakala to play AV on Shield Connect. Sh- Shield Connect is a dynamic platform to connect all the doctors at one place with scientific related information through webinars, blogs, and literature. And also, Shield Connect strives to improve the state of the patient care, adapting to the modern day practices, and transforming the healthcare with science driven by innovation. I request all the delegates to please have a look at the Shield Connect webpage. You'll find all the past and upcoming webinars. And with this, I welcome you on, Dr. Divya, for today's talk on the role of potential role of vaginal microbiota in fertility to make better understanding of the natural fertility as well as the role of vaginal microbiota in the ART. Yeah, thank you, ma'am. Over to you.
Thank you. So, good evening, everybody. Here, of course, we have gathered here to discuss a very important topic on the role of vaginal microbiota in fertility. So, the vaginal microbiota plays a very important role in maintaining the physiological hemostasis of the environment of the vagina, thereby protecting the vagina from the colonization by various opportunistic pathogens. A healthy vaginal ecosystem is characterized by the predominance of certain lactobacillus species, mainly Lactobacillus crispatus, Lactobacillus iners, Lactobacillus gasseriae, Lactobacillus jensenii, which actively contribute to lower the vaginal pH, that is, maintaining an acidic vaginal environment through lactic acid production. So, vaginal hemostasis is maintained by a balance of good bacteria as well as harmful bacteria. The normal vaginal microflora keep changing in case of females right from the newborn period to prepubertal stage to pubertal stage to menopause. In newborns up to 6 weeks, the pH is acidic with a predominance of lactobacilli and staphylococcus epidermidis, streptococci, enterococci, etc. Prepubertal, again, the pH becomes neutral with streptococci, enterococci, staphylococcus epidermidis. Puberty, again, it becomes acidic, and menopausal, again, the environment becomes neutral. Now, the microbiome play a very important role in human reproduction. It has been found that the microbiome is not only present in the vagina, but in the endometrium, in the tubes, as well as the peritoneal cavity. So any alterations in the microbiome plays a very important role in affecting fertility, conception, as well as the reproductive outcome. It has been found to impair folliculogenesis, alter the gonadotropin response, affect fertilization, embryo migration, as well as altering the immune milieu, leading to increased pregnancy losses or maybe sometimes even late pregnancy losses. It can also lead to preterm birth through intraamniotic infections, affect the growth of the baby, post birth of the baby. It can also lead to puerperial sepsis. So, as we discussed, these organisms are not only there in the vagina but also in the upper female reproductive system. What are the factors which may modify vaginal microbiota? So, of course, age plays a very important role. Infections, the ethnicity, smoking, cancer, pregnancy. So, in pregnancy, there's an increase in the vaginal secretions. The pH, which is there, becomes more acidic. There's a lower concentration of mycoplasma and ureaplasma. Uh, as far as infections are concerned, in bacterial vaginosis, there's a disturbance in the lactobacillary microflora. So the pH becomes more than 4.5. There's a grayish-white discharge. There are inflammatory changes. And what are the main organisms which cause bacterial vaginosis? It's Gardnerella vaginalis and Mobilingus. As far as age is concerned, mainly in adult women, there is a high level of estrogen and glycogen levels. The vaginal epithelium is thick. There is a high number of lactobacillus species, and the pH of the vagina is low. As far as menopause is concerned, postmenopausal women, the vaginal epithelium becomes very thin and disrupted. The lactobacilli reduce in number, so the pH becomes more alkaline. Smoking too affects the vaginal microbiota by lowering the estrogen levels. There is a presence of BPD in the vaginal secretions, which decrease the lactobacillus species concentration. Cancer too alters the lactobacillus species in the vagina, thereby leading to a high diversity of microorganisms. So there was a study, the Helios study, involving 100 women of major ethnic groups in Amsterdam, conducted by Bogdorf, Van der Veer et al., wherein they've mentioned the role of ethnicity in vaginal microbial composition. They found that bacterial vaginosis is 2 times more prevalent in communities with African background compared to Dutch background. So could there be a role of genetics, or the intravaginal practices could be a confounder? So the endogenous factors play a very important role in influencing the vaginal microbiota. So as we've noticed that there's a change from childhood to menopause. During menstruation, the non-lactobacillus species increase in number, while the lactobacilli decrease or stay approximately the same number. During pregnancy, it is seen that the lactobacillus dominant microbiota is strengthened because of higher estrogen levels. But however, pregnant women are more prone to getting vulvovaginal candidiasis as compared to non-pregnant women. And menopause, due to lower estrogen levels, lactobacilli decrease in number and the vaginal pH is increased. So therefore, it's found that estrogen plays a very important role in affecting the composition of the lower genital tract microbiota. There are various diagnostic criteria which help us to diagnose bacterial vaginosis. So one of them is the AMSEL criteria for bacterial vaginosis, which is characterized by a thin grayish white homogeneous discharge, pH more than 4.5, 10% potassium hydroxide addition to the vaginal discharge produces a fishy odor. And there are clue cells which are seen on wet mount microscopy. It has a precision accuracy of 83%, but at the same time, there are certain limitations of this criteria because presence of semen may affect it. Similarly, douching or pre or post menstrual cycle, there could be an alteration in the vaginal secretions. Candida and trichomoniasis secretions may give the same appearance as bacterial vaginosis. At the same time, clue cells may also be looking very similar to degenerative cells or debris. Then there's this Nugent scoring system wherein the lactobacilli are identified. They are gram-positive bacilli. So if they are present, the scoring is 0 to 4. Similarly, if there are small gram-variable rods or gram-negative rods or small variable cocobacilli, the score is 4 to 6. So there are various other methods too, like sensor array, polymerase chain reaction, proline aminopeptidase activity, etc. What are the consequences of having bacterial vaginosis? One is it leads to an increased susceptibility to various STDs and STIs, including HIV. It results in an increased risk of preterm labor. It can also affect fertility, lead to implantation failure, recurrent pregnancy loss, as well as it may increase the long-term propensity for cancer. So evidence from various studies shows that differential vaginal microbiome composition in infertile patients has been found as compared to healthy and fertile women. So an abnormal vaginal microbiota has been seen associated with a poor reproductive outcome, particularly in patients undergoing IVF, and it can also lead to early spontaneous abortions. So it's been found out that just besides lactobacillus, there are other specific microbes too, which have been associated with implantation failure or miscarriage rates. The semen too harbors a specific microbiome, mainly containing anaerobic bacteria as well as lactobacillus. During spontaneous conception, the microbial content of the sperm might enter the uterine cavity, and this will result in interaction with the endometrial environment, including the local microbiota. So basically, the lactobacillus produce lactic acid. The main property of this lactic acid is to lower the pH of the local environment, thereby providing protection against various invading pathogens. And it also prevents vertical transmission by affecting the integrity of the cervical plug. They've also been found to produce bacteriocins, which inhibit bacterial growth. So it's been found that different species of lactobacilli have different immunological properties. For example, Lactobacillus crispatus plays a very important role in protection against pathogens. Lactobacillus iners is associated with the presence of bacterial vaginosis by causing altered gene expression, including defense against bacteriophages. So the rapidly dividing blastocyst depends heavily on aerobic glycolysis, which is characterized by the formation of lactate. This high level of aerobic glycolysis has been explained as energy provision for the dividing blastocyst. So during implantation, the levels of available oxygen are extremely low. So therefore, the embryo needs to consume more amount of glucose, and thereby it results in the production of lactate. This lactate-rich environment around the blastocyst helps in local endometrial breakdown and thereby facilitates invasion and modulates the immune response to prevent the rejection of the embryo. Plus, the lactic acid that is produced by the local diversity of lactobacilli supports the receptivity of the endometrium and allows the invasion of the developing blastocyst. Viruses too play a very important role in the microbial community because they act as bacteriophages. So they basically infect bacteria, kill the infected microbes, and also allow for the horizontal gene transfer. Several mechanisms have been postulated which describe the bacteriophage driven dysbiosis. So, how do they basically act? They kill the commensal bacteria by lytic infection. They integrate the phage DNA into the bacterial genome to enhance the bacterial function. So this bacterial biomass seems to decrease from the vagina to the endometrium. The peritoneal fluid too contains a similar bacterial biomass as the endometrial samples. So in fact, there have been various studies which have been conducted which show the differences in the microbial profiles right from the vagina to the uterine cavity, which have been found during laparoscopy. It's been found to differ in women suffering from adenomyosis or endometriosis or fibroids. So there have been various studies which have been conducted on the vaginal microbiome, the endometrial microbiome, which show that any alteration in the local microbiome affects the chances of fertility or the success of IVF or ICSI treatment, and it can also lead to early pregnancy losses. Endometrial studies too have been conducted. So they mentioned that endometrial bacterial profiles of pregnant and non-pregnant patients were comparable, and the endometrial fluid and vaginal microbiota have a different profile. There's a significant variation found in the community composition between the recurrent implantation failure patients and patients who were the control group. So there's an article which mentions a prospective observational study conducted in Milan, Italy by Virginia Matto, Enrico Papelio et al., which mentions that the differential composition of vaginal microbiome, but not of seminal microbiome, is associated with successful IUIs in couples with idiopathic infertility. So it's known that dysbiosis, when seen in obstetrics, can lead to inflammatory states. So thereby it can affect the health of the developing pregnancy, resulting in spontaneous preterm birth and other adverse obstetric outcomes. For fertility treatment, it's very important to have a healthy full-term live birth. And therefore, it's found that the local microbiome plays a very important role. And any change which is seen in the pre-implantation and the peri-implantation phase will have its wide-reaching implications. So as we've already discussed, that there have been various studies which mention the role of microbiota and its relation to IVF outcomes. So any alteration seen or bacterial vaginosis has been found to affect IVF success outcomes and has been related to poor pregnancy outcomes. So there are certain studies which confirm that vaginal microbiota rich in lactobacillus species without bacterial vaginosis, either clinical or subclinical, leads to more positive outcomes with ART. This was a studies conducted by Babu et al. In 2017, Eckert et al. In 2003, and etc. So in another study conducted in 2019, it has been mentioned that Lactobacillus crispatus, in particular, dominant microbiomes were associated with a higher live birth rate. So it's very important that prior to doing IVF, having a better knowledge about the vaginal microbiota will definitely help healthcare professionals and couples decide on the timing of the IVF cycles to get better results. Endometrial dysbiosis too can lead to implantation failure and infertility. So it's been found that the endometrium is more receptive when there are more number of lactobacilli, and with a lower proportion of lactobacilli, it definitely will affect the outcomes. Hormonal fluctuations, especially estrogens, are implicated in the regulation of the microbiota and thereby affect the preparation of the endometrium for implantation and pregnancy. We've already discussed about the increased risk of preterm labor if there is any alteration in the vaginal microbiota. So a lactobacillus dominant vaginal microbiota and increased diversity have been associated with higher risk of preterm birth. There's an article which is published in the Journal of Translational Medicine, wherein they mentioned that RPL, recurrent pregnancy loss, has been found to be associated with a leaky gut. Let's go to the treatment guidelines for bacterial vaginosis. So it mainly involves taking oral metronidazole 500 milligram orally twice a day for 7 days. One can even use a metronidazole gel intravaginally for 5 days, or clindamycin cream intravaginally for 7 days. Alternative treatments, of course, could include clindamycin pessaries or clindamycin orally or tinidazole orally. In pregnancy, too, the recommended regimens are consuming metronidazole or tinidazole. Now, is it important to screen and treat asymptomatic patients? Screening may not be recommended, but however, it's very important to screen and treat prior to any invasive procedure like a surgical abortion or hysterectomy. So, male partners may not be needed to be treated because they don't get bacterial vaginosis that easily and don't transmit it. But however, if there are female partners of women with bacterial vaginosis, and it's very important to examine and treat them. It has been found that bacterial vaginosis may recur, especially a month after therapy. So this could be due to the failure of lactobacillus flora to recolonize, thereby leading to persistence of the bacterial vaginosis associated organisms. So in this case, how do we manage? We give them twice weekly metronidazole gel for 6 months in order to reduce the incidence of recurrences. There are other methods too which may help, like consuming yogurt or any exogenous lactobacillus treatment. So antibiotics and antifungals remain the mainstay of therapy. But however, the recurrence rate may be higher and these drugs may be associated with side effects. So in this case, it's also advisable to take probiotics containing lactobacillus as well as prebiotics. They can be used, of course, post intake of antibiotics, particularly in order to reduce the incidence of recurrent rates over a long period of time. What are probiotics? As per the WHO, they are defined as live microorganisms which, when administered in adequate counts, confer a health benefit on the host. So they're basically products of human origin with acid and bile stability, and they persist in the human intestinal tract. They adhere to the human intestinal cells. They produce antimicrobial substances, and they're very safe, and they have produced a clinical and documented health effect. Prebiotics are compounds which are present in the food that induce the growth or the activity of beneficial microorganisms. So prebiotics as well as probiotics together are known as symbiotics. Prebiotics basically stimulate the growth and reproduction of only the useful microflora. Thereby, they improve the work of the digestive system, stimulate peristalsis, reduce the formation of gases, stimulate the local immunity, and remove excess mucus from the walls of small intestine, and help in maintaining an optimum pH in the intestine. So what is the rationale of using probiotics with lactobacilli? So basically, they help in reducing the incidence of sexually transmitted diseases, prevent preterm labor, and they help to maintain the vaginal health, give a good quality of life to women. They can be inserted directly into the vagina or taken orally and go from the gut to the vagina. They're also used in women more prone to urogenital infections, but also can be used by healthy women to maintain the normal flora. So whether one should use probiotics versus antibiotics. Of course, there's a specific role of antibiotics which we cannot deny and which we cannot avoid. But however, antibiotics if misused, they can damage the commensal microflora, they can increase the occurrence of resistant bacteria, and can have various other adverse effects. For that matter, probiotics, if used in adjunct to antibiotics, they can help to restore the commensal microflora. So, what is the ideal treatment as far as probiotics are concerned? It's very important that the probiotic capsules that we use contain Indian genome specific strains, especially vaginal specific strains, and they should have maximum colony forming units of at least 10 billion. Of course, here are studies which mention that it's important to control vaginosis in order to improve reproductive health. So, this was a study which was conducted and mentioned in November 2014 by Hemlata et al., which mentioned that exogenous strains of lactobacilli have been suggested as a means of re-establishing a normal, healthy vaginal flora. And very carefully selected strains can eliminate bacterial vaginosis as well as exert an antiviral effect, thus reducing viral load and preventing fetal and neonatal infection. So, these probiotics can also aid in recovery from infection. There's the other study published in Human Reproduction Journal, which mentions that abnormal vaginal microbiota may be associated with poor reproductive outcomes in IVF patients. So why is it essential to have strains of native origin? So the products with strains of Western origin may not have the same benefit to the patients. So it's widely accepted that for local population, it's very important to have native strains. And the native strains which are there, which are important for us, are the Lactobacillus crispatus, Lactobacillus jenseni, Lactobacillus gasseri, Lactobacillus iners, Lactobacillus vaginalis, etc. So these have been identified as the right lactobacilli, which are very important for maintaining the vaginal health in a study conducted and mentioned in 2005. So again, this is a slide which mentions that in the European Journal of OBGYN Reproductive Biology, that pregnancy rate has been found to double if bacterial vaginosis is treated. Thank you. This marks the end of our discussion. If there are any further questions, please free to ask.
Thank you, ma'am. Thank you very much for your excellent and superlative talk. So it's always an honor to learning to hear you, ma'am. Actually, from the field of sequencing and the metagenomics is changing the way we understand the reproductive tract microbiome and its impact on reproductive success and failure. The fact that this environment may affect the gametogenesis and that it changes the hormonal and leading to the time of embryo transfer as well as the implantation. So it clearly suggests that there is a very important role of that we just beginning to comprehend it, and also we need to understand, and perhaps this understanding may lead to the ability to manipulate this micro environment to improve the outcomes. Thank you, ma'am. Thank you for your excellent talk. So, ma'am, if you allow me, then we will take the question and answers.
Yeah, sure, no problem.
Yeah. Ma'am, we have a first question that is active follicular microbiome does affect ART outcomes.
So there are studies which have been found, but however, further research is needed on the same.
Okay. Yeah, and we have one more question that is whether antimicrobial use at the time of embryo transfer will decrease the burden of bacterial remnants, which still serves to modulate the immune system.
Honestly, I don't recommend the misuse of antimicrobial agents at the time of embryo transfer unless there has been any documented infection before that. So, in case if there's any infection, then it's better to treat that infection before we go for transfer. In case there are any factors which indicate infection, but however, one can administer oral probiotic agents or vaginal probiotic agents which can help to improve the local microflora.
Thank you, ma'am. And, there are appreciation messages from the delegates. Excellent presentations. And we have one more question. How will you select the particular probiotic or a prebiotic is better than the other brands? In other words, which is the best ingredient that good pre or probiotic should contain?
So we've mentioned that we have to go for the native origin specific microbiota, lactobacillus species, which we've already discussed, acidophilus, etc. So these particular 6 to 7 lactobacillus species should be present, as well as you focus on the colony forming units, at least if it's 10 billion and more than that, so then it's found to be more effective.
Thank you, ma'am. Ma'am, I don't find any additional questions from the delegates. So if you allow me, then we will close this webinar.
Yeah, sure, we can close it.
Yeah. Thank you, ma'am. Thank you once again for giving your valuable time and giving us the excellent understanding of the role of microbiome in pregnancy and also the infertility. Yeah,
You're
thank you.
welcome. Thanks a lot for inviting me. It was
Yeah.
a pleasure.
Yeah, many thanks from the Shield team. And also I thank all the delegates for participating in this webinar.